If you've ever had back pain or issues with sciatica, then you definitely know how it can slow you down, and about half of us will deal with it at some point in our lives. Joining us this midday with Alabama Pain Associates is Dr. Ty Thomas. Welcome.
Thank you.
And you have some advice. We've been talking commercial. I am the one of two, but we're two of two.
We're two of two because we both had it.
Yes, we have both. So tell me, what is sciatica?
So sciatica is pain that actually you feel in your leg. It's usually just one leg at a time, but it's actually coming down your sciatic nerve. Now, most of the time, it originates in your back, in your low back, usually from a herniated disc is usually how we get it. Mm-hmm. And there's a graphic up, and what happens is that disc, when it herniates, it impinges or it irritates the nerve in that nerve root, and you feel that going down the sciatic nerve. Now, we also call that different things: radiculopathy, radiculitis.
I call it some things you can't even say on TV.
Yeah, most people it's sciatica, and it can feel burning, it can feel sharp, it can just be a numbness, it can be cold sensation, pins and needles. It has a whole lot of different sensations, but it's something that it can be a serious issue, so it needs to be addressed right away.
So now, what causes sciatica? You mentioned it usually originates in lower back.
Right, it does, and usually when somebody young who gets it, like yourself, you don't typically get the that pattern. It's usually from a herniated disc. Mm-hmm. When you're older, over time it can become chronic, and it's usually from arthritis, and that's usually from a muscle spasm around an arthritic joint. But it's doing the same thing. It's putting some pressure or some tension or traction along that nerve, and that nerve's getting irritated, and you're feeling it down your leg.
Okay, so other than screaming and clenching and and being mean to your coworkers, what are some treatments?
So treatment absolutely depends on getting the right diagnosis. Mm-hmm. Why is it happening? Is it a herniated disc? Is it arthritis? Is it a muscle spasm? And where exactly is it coming from? Because treatment can range from a big-time spinal surgery to over-the-counter medications, maybe some muscle relaxers and physical therapy. And the spectrum is everything in between.
So tell me, I've told you that I suffered with this for far too long. What's the average span from, can you just go without treatment and that nerve will die down, will calm down?
Yeah, so normally, as in a case, like what happened to you, usually it will go away in 6 weeks on its own. But 6 weeks is a long time to hurt.
That's a very long time.
So, and I always tell everybody, because this happens to me usually once or twice a year, I'm like, I do not want to feel that pain. Mm-hmm. And so, and I know what's going on with me, but usually an MRI, maybe a nerve test, will tell exactly where it's coming from, as well as physical exam and some more detailed history. But an epidural steroid injection aimed at the area where that problem is usually knocks it out right away. And then once you feel better, then you can do the things that will prevent it. And that's staying active, exercise, strengthening the muscles around the spine.
Right, that's what I was going to ask you about. How can we prevent it? And so they always say, tighten, have stronger ab muscles to take the pressure off the back. But if your back is hurting, how do you then exercise?
Exactly, and that's usually what happens. You get when you're hurting, go do physical therapy. I'm like,
but it hurts too much.
It does, and so our approach at Alabama Pain Physicians is we like to get to the bottom of the issue first, make it, let's feel better, and then you can go do those things and prevent them from happening.
Okay. So, sounds good. Thank you so much, Dr. Thomas.
Thanks.
I'm not hurting right now.
Good.
But I feel like I won't hurt again because of this conversation.
All right.
And if I do, I'll come see you.
Thanks.
Thank you.